There is a moment several times a day that most people with arthritis treat as a time for rest, and that the research suggests may actually be one of the most valuable windows for movement available in the entire 24-hour cycle. That moment is right after you eat. The instinct after a meal is to sit, to settle into the couch, to let digestion happen while the body rests from the activity of preparing and eating food. For most of human history, and for most cultural eating customs around the world, post-meal rest has been the default, and for adults without joint disease, this default carries little consequence either way. But for adults with arthritis specifically, the research on what happens to joint stiffness, blood glucose, and inflammatory signaling in the period immediately following a meal suggests that a brief, simple, specific movement practice performed for just a few minutes after eating produces measurable reductions in joint stiffness and several other benefits that the post-meal rest period does not provide. Today I am going to show you exactly what that movement is, the specific physiological mechanisms that explain why it works within minutes rather than requiring the weeks or months that most exercise interventions for arthritis require to show benefit, and exactly how to perform it correctly for the maximum joint protective and stiffness reducing effect. Before we begin, subscribe to this channel right now if you want evidence-based, immediately actionable health guidance specifically designed for adults managing arthritis and joint stiffness. We create this content every week because the most useful information is often the simplest, once you understand the science behind it. Hit subscribe. Let us start with what happens to your joints, your blood glucose, and your inflammatory signaling in the period immediately following a meal, because understanding this post-meal physiology is what makes the specific movement practice make complete scientific sense rather than simply being an arbitrary recommendation. When you eat a meal, particularly one containing carbohydrates, your blood glucose rises over the following 30 to 90 minutes, with the magnitude and duration of this rise depending on the glycemic content and overall composition of the meal. This post-meal glucose elevation triggers a cascade of physiological responses directly relevant to joint health. The rising glucose promotes the formation of advanced glycation end products through the same mechanism we described in our worst foods video, and it triggers an insulin response that has measurable effects on inflammatory cytokine gene expression in immune cells circulating through the body, including the macrophages that infiltrate and activate the synovial membrane in osteoarthritic and rheumatoid joints. Research has consistently documented that this post-meal period, sometimes called the postprandial period in the scientific literature, represents a window of measurably elevated systemic inflammatory activity, with studies showing temporary increases in circulating inflammatory markers including C-reactive protein and interleukin-6 that peak approximately 1 to 2 hours after eating, and that are proportional to the glycemic load and the overall inflammatory potential of the meal consumed. For adults with arthritis, whose joints are already managing a baseline inflammatory burden, this post-meal inflammatory spike represents a predictable, recurring window during which the joint environment becomes measurably more inflammatory several times throughout the day. The second relevant post-meal physiological change is the redistribution of blood flow that occurs during digestion. As the digestive system increases its metabolic activity to process the meal, a meaningful proportion of circulating blood volume is redirected toward the gastrointestinal tract and away from peripheral tissues including the joints and the periarticular muscles. This redistribution means that the already reduced synovial fluid circulation that arthritic joints depend on for cartilage nutrition, the mechanism we described in detail in our daily walking video, is further reduced during the post-meal period when blood flow is preferentially directed elsewhere. The combination of these two factors, the temporary post-meal inflammatory spike and the temporary reduction in peripheral and joint blood flow, explains why many adults with arthritis report that their joint stiffness and discomfort feels worse, or at minimum does not improve, during the period immediately following a meal. This is not simply the sensation of having eaten, it reflects measurable physiological changes occurring in the joint and circulatory environment during this specific window. Now here is where the simple movement comes in, because brief, light movement performed during this post-meal window directly counteracts both of the physiological changes we have just described, through mechanisms that begin working within minutes rather than requiring the weeks of consistent practice that most exercise interventions for arthritis require to produce measurable benefit. The specific movement is a post-meal walk, but the timing, duration, and intensity parameters that the research has established for this specific application differ from the general daily walking protocol we detailed extensively in our previous video. The timing parameter: the post-meal walk should begin within 10 to 15 minutes of finishing the meal, while the postprandial glucose rise and the digestive blood flow redistribution are in their early phases rather than waiting until these processes have fully developed. Research on postprandial walking and blood glucose management has consistently found that walking initiated promptly after eating produces a measurably greater blunting effect on the glucose rise than walking initiated after a longer delay, because the muscle contraction-induced glucose uptake into skeletal muscle competes most effectively with the digestive glucose absorption when both processes are occurring simultaneously. The duration parameter, just 10 to 15 minutes of walking after a meal, has been documented to produce measurable effects on post-meal glucose excursion and on the inflammatory and circulatory changes we have described. A remarkably brief time investment compared to the 30-minute daily walking protocol we detailed in our previous video, though the two practices are complementary rather than redundant. The intensity parameter, the post-meal walk, should be performed at a gentle, easy pace, distinctly easier than the moderate pace we recommended for the primary daily walking protocol. This gentler intensity reflects the different physiological goal of the post-meal walk, rather than producing the cardiovascular conditioning and muscle-derived interleukin-6 anti-inflammatory effect that the primary daily walk targets. The post-meal walk is specifically aimed at promoting the redirection of blood flow back toward peripheral tissues, including the joints, and at activating the skeletal muscle glucose uptake that blunts the postprandial inflammatory cascade, both of which occur effectively even at a gentle, conversational pace. Research published in the journal Diabetologia found that a 15-minute walk performed after each meal produced significantly greater improvements in 24-hour blood glucose control than a single 30-minute walk performed at any other time of day, even though the total walking duration was identical, establishing that the timing of walking relative to meals, not simply the total daily walking volume, is a clinically significant variable. While this research was conducted primarily in the context of diabetes and glucose management, the same glucose-related mechanisms we have described as contributing to joint inflammation through advanced glycation end product formation make this finding directly relevant to arthritis management as well. Before we continue, here is your pause. Do you currently rest or remain seated after meals, or do you already incorporate some movement during this period? Drop a comment below right now and tell us your current post-meal habits and whether you have noticed any connection between what you do after eating and how your joints feel. We read every comment, and your experience helps this community understand what changes might be most valuable to try. The specific joint stiffness reduction that adults with arthritis experience from post-meal walking operates through a third mechanism beyond the glucose and blood flow effects. We have described the direct mechanical effect of movement on the synovial fluid distribution within the joint itself, the same compression-decompression cycle we detailed extensively in our daily walking video, as the primary nutrient delivery mechanism for cartilage. When a joint has been held in a relatively fixed position, whether during a meal, where the seated posture limits knee and hip movement, or during the digestive period, when many people remain seated, the synovial fluid within the joint settles into an uneven distribution, with fluid pooling in the lower portions of the joint capsule according to gravity and the joint's resting position. This uneven fluid distribution is part of why joints often feel stiffer after a period of sustained sitting. Independent of any inflammatory or glucose-related mechanism, the fluid redistribution that occurs with the first several minutes of movement is itself a contributor to the immediate, rapid reduction in stiffness sensation that many people notice within the first few minutes of standing and walking after sitting for an extended period. This mechanical fluid redistribution effect explains why the stiffness reduction from a post-meal walk can be noticed within minutes much faster than the metabolic and inflammatory mechanisms we described, which operate on a slightly longer physiological timeline of tens of minutes to a few hours. The immediate minute-scale relief that many people notice when they stand up and begin walking after a meal reflects this rapid mechanical fluid redistribution, while the more sustained benefits for glucose control and inflammatory signaling accumulate over the following 1 to 2 hours as the walking continues. The practical implementation after finishing a meal. Allow 10 minutes for the immediate post-meal settling that most people prefer before transitioning to movement. This is a practical accommodation rather than a physiologically required delay. Walk at a gentle, easy pace for 10 to 15 minutes around the home, in a hallway, round a yard or garden, or outdoors if circumstances allow. This walk does not need to be the primary daily walking session we detailed in our previous video. It is a distinct, complementary practice performed after each of the day's main meals: breakfast, lunch, and dinner, providing 3 separate 10 to 15-minute windows of post-meal movement throughout the day. For adults whose mobility limitations make a full walk impractical immediately after a meal, even gentle marching in place, a slow walk to a nearby room and back repeated several times, or light stretching and joint mobility movements performed while standing can provide a meaningful portion of the mechanical fluid redistribution and circulatory benefit. The relationship between this post-meal walking practice and the comprehensive daily walking protocol we detailed in our previous video is complementary rather than redundant. The primary 30-minute daily walk provides the cartilage nutrition through sustained synovial fluid compression-decompression, the quadriceps and periarticular muscle strengthening, and the muscle-derived interleukin-6 systemic anti-inflammatory effect. The post-meal walks provide the specific glucose blunting, post-meal inflammatory cascade reduction, and immediate mechanical, joint stiffness relief that the post-meal window specifically offers. The specific application of this practice to adults with rheumatoid arthritis and other inflammatory arthritis conditions deserves separate mention. In rheumatoid arthritis, where the synovial membrane is already producing elevated levels of tumor necrosis factor alpha and interleukin-6 as part of the underlying autoimmune disease process, the additional postprandial inflammatory signal from a high glycemic meal represents an additive burden on an already activated inflammatory system. Research examining dietary glycemic load and rheumatoid arthritis disease activity has found that higher glycemic load diets are associated with greater disease activity scores and higher inflammatory marker levels in rheumatoid arthritis patients. For adults with rheumatoid arthritis, the post-meal walking practice may provide a meaningful complementary strategy alongside ARD and biologic medications, not a substitute for disease-modifying treatment, but an additional low-risk tool. The practical barriers many adults encounter deserve specific problem-solving guidance. For adults who eat meals away from home, simple strategies include parking further from the entrance at restaurants, taking a short walk around the office building after a workday lunch, and at social gatherings, suggesting a short walk as part of the social activity itself, a practice several cultures have long incorporated into their mealtime customs, reflecting an intuitive cultural recognition of the benefits we have described through the lens of modern physiological research. For adults whose meals are eaten at times when walking outdoors is impractical, indoor walking alternatives, walking laps around the interior of a home, or marching in place provide the same mechanical and physiological benefits. The circadian dimension of meal timing deserves consideration. Research on circadian metabolism has documented that insulin sensitivity is generally highest in the morning and progressively declines throughout the day, meaning an identical meal consumed at dinner typically produces a larger glucose excursion than the same meal consumed at breakfast. This suggests the post-meal walking practice may provide its greatest relative benefit following the evening meal. For adults, building this habit gradually, beginning with a consistent post-dinner walk before expanding to post-breakfast and post-lunch walks, may represent the most effective sequencing. The additional benefit of post-dinner walking specifically relates to the overnight growth hormone-mediated cartilage repair window we discussed in our before-bed fruits video. A post-dinner walk that reduces the postprandial inflammatory spike and promotes more complete digestion before bedtime may contribute to better sleep quality and a less inflamed starting point for the overnight repair processes that arthritic joints depend on. The complete picture that emerges from this video is one of remarkable mechanistic coherence across the comprehensive arthritis management program we have built on this channel. The post-meal walk reduces the postprandial inflammatory spike that the Worst Foods video taught you to minimize through dietary choice. It promotes the synovial fluid circulation that the daily walking video established as essential for cartilage nutrition, and it potentially supports the sleep quality that the Before Bed Fruits video identified as critical for the overnight repair window. This is an integrated, mechanistically coherent understanding of how diet, movement, and sleep interact to determine the inflammatory and structural environment in which your joints either deteriorate or are protected. Meal by meal, day by day, year by year, your next meal is an opportunity, not simply to nourish your body, but to follow that nourishment with a few minutes of movement that the research suggests can measurably reduce the joint stiffness and inflammatory burden that meal might otherwise contribute to. 10 to 15 minutes after your next meal. That is all this practice requires, and the science suggests it is enough to make a measurable difference. The specific biomechanical considerations for the post-meal walk that maximize its joint protective benefit while minimizing any digestive discomfort deserve attention. Because some adults are hesitant to walk immediately after eating out of concern that movement during active digestion might cause stomach discomfort. And understanding the appropriate intensity calibration addresses this concern directly. The gentle pace we have specified for the post-meal walk distinctly easier than the moderate pace of the primary daily walking protocol is specifically calibrated to avoid the digestive discomfort that can occur with more vigorous exercise immediately after eating. Vigorous exercise performed shortly after a meal can produce gastrointestinal discomfort because intense physical activity redirects blood flow toward working skeletal muscles and away from the digestive system at a moment when digestive blood flow is most needed, creating a competing demand that can produce the cramping or nausea that some people have experienced after exercising too soon or too intensely after eating. The gentle, easy pace of the post-meal walk we have described avoids this competing demand because the metabolic intensity is low enough that the digestive system's blood flow needs are not significantly compromised by the modest increase in skeletal muscle blood flow that gentle walking requires. This is why the research on postprandial walking specifically uses gentle to moderate intensities rather than vigorous exercise, and why the post-meal walk we are recommending should feel distinctly easy, a pace at which you could comfortably hold a conversation without any breathlessness, walking at perhaps half the intensity of your primary daily walk. For adults who have experienced digestive discomfort with physical activity after eating in the past, starting with an even gentler pace than the general recommendation, a slow stroll rather than a brisk walk, and gradually increasing the pace across several days as comfort allows, is a reasonable individualized approach to finding the right intensity calibration for your specific digestive tolerance. The meal composition consideration also deserves mention, because the postprandial inflammatory and glucose response we have described throughout this video varies considerably based on what specifically was eaten, and this variation has practical implications for prioritizing when the post-meal walking practice may provide its greatest relative benefit. Meals higher in refined carbohydrates and added sugars, the foods we identify as among the worst for arthritis inflammation in our 7 worst foods video, produce a larger and more prolonged postprandial glucose and inflammatory response than meals built around the anti-inflammatory dietary pattern we have detailed extensively throughout this series, including adequate protein, healthy fats, and high-fiber vegetables and whole grains. This means that the post-meal walking practice may provide proportionally greater benefit following meals that are higher in refined carbohydrates, precisely the meals that the comprehensive dietary guidance throughout this channel encourages minimizing in the first place. This relationship illustrates an important principle that applies throughout the comprehensive arthritis management program we have built. The various interventions we have detailed are not independent, isolated practices but interact with and amplify each other in ways that reward comprehensive implementation. The adult who has already adopted the anti-inflammatory dietary pattern experiences a smaller postprandial inflammatory spike to begin with, meaning the post-meal walk has less inflammatory burden to counteract. The adult who occasionally consumes a higher glycemic meal, perhaps at a celebration or social occasion where strict dietary adherence is less practical, can use the post-meal walking practice specifically to mitigate the larger inflammatory and glucose response that meal will produce, providing a practical harm reduction strategy for the realistic moments when perfect dietary adherence is not the priority. This is not permission to disregard the dietary guidance we have provided throughout this series in favor of relying on post-meal walking to counteract poor food choices. The magnitude of the walking-related mitigation is real but partial, not complete, and the most effective approach remains the combination of the anti-inflammatory dietary pattern as the primary strategy, with the post-meal walking practice as a complementary tool that provides additional benefit on top of good dietary choices, and that provides some mitigation during the inevitable moments when dietary choices deviate from the ideal. The hydration component of the post-meal period deserves brief mention as a complementary practice that supports the same physiological goals as the post-meal walk. Adequate fluid intake around mealtimes supports the digestive process, supports the blood volume needed for the dual demands of digestion and the post-meal walk's modest skeletal muscle blood flow requirements, and supports the renal clearance of the metabolic byproducts of digestion, including the uric acid formation from purine and fructose metabolism we described in our gout video. A glass of water consumed with or shortly after a meal, before beginning the post-meal walk, is a simple complementary practice that supports the physiological processes the walk is designed to optimize. The cumulative effect of implementing the post-meal walking practice consistently across weeks and months extends beyond the acute, meal-specific benefits we have described to a broader pattern of activity that contributes to the overall daily movement volume that adults with arthritis benefit from. 3 10 to 15-minute post-meal walks, performed consistently after breakfast, lunch, and dinner accumulate to 30 to 45 minutes of additional daily movement beyond the primary 30-minute daily walk we detailed in our previous video. A substantial increase in total daily activity, independent of the specific postprandial mechanisms we have described, contributes to the broader cardiovascular, muscular, and metabolic benefits of regular physical activity that support healthy aging and joint health throughout the body. This cumulative volume consideration matters because adults who successfully implement both the primary daily walk and the post-meal walking practice are achieving total daily walking durations that approach or exceed the activity levels associated with the most favorable outcomes in the population studies of physical activity and arthritis we have referenced throughout this channel's content, without requiring any single, longer, more demanding exercise session that might feel less achievable for adults managing significant joint pain or limited exercise tolerance. The accumulation of multiple brief, manageable walking sessions throughout the day represents a genuinely achievable pathway to the total daily activity levels that the research associates with the best joint health outcomes, even for adults who find a single 30-minute or longer continuous walking session challenging to sustain. This is the complete picture of why a movement so simple, walking gently for 10 to 15 minutes after a meal, deserves the dedicated, mechanistically detailed treatment this video has provided, not because the practice itself is complicated, but because understanding why it works when it works best, and how it integrates with the comprehensive arthritis management program this channel has built, transforms a simple suggestion into a scientifically grounded, confidently implemented daily practice. For adults wondering whether this same post-meal movement principle applies to other joints beyond the knees and hips that walking primarily engages, the underlying mechanisms we have described, postprandial inflammatory reduction and synovial fluid circulation, are systemic and joint general rather than specific to the lower extremity joints that walking most directly mobilizes. For adults whose primary arthritis burden is in the hands, as we detailed in our previous video, gentle hand and finger movements performed during the post-meal walk, opening and closing the hands, gentle finger stretches, or simply a lying natural arm swing during the walk rather than holding the arms, still can provide a complementary mechanical benefit for hand joint synovial fluid circulation, alongside the walking-specific benefits for the lower extremities. For adults whose arthritis significantly affects the shoulders or upper body, gentle arm circles or shoulder rolls performed either during the walk or immediately before or after can extend the joint mobility benefit to these upper body joints that walking alone does not directly engage. The post-meal window is, in this broader sense, an opportunity for whole-body gentle movement rather than exclusively a walking-specific practice. Though walking remains the most extensively researched and most practically accessible form this movement can take for most adults, given its simplicity and minimal equipment requirements. Adults who wish to extend the post-meal movement practice beyond walking specifically might incorporate brief, gentle range of motion movements for whichever joints are most affected by their particular pattern of arthritis, performed either as a brief routine before the walk begins or integrated into the walk itself through natural arm and upper body movement. The seasonal and environmental adaptability of this practice deserves final practical mention, because the simplicity of the post-meal walk that we have emphasized throughout this video is also what makes it remarkably adaptable to circumstances that might otherwise interrupt a more demanding exercise routine. Unlike the primary daily walking protocol, which research suggests benefits from outdoor settings and natural terrain for the most complete benefit, the post-meal walk's brief duration and gentle intensity make it equally effective whether performed outdoors, in a hallway, round a small apartment, in an office building during a lunch break, or even in place, if circumstances genuinely prevent any ambulatory. This adaptability matters because consistency performing this practice after most meals, most days, across months and years is what produces the cumulative benefit the research documents. And a practice that can be maintained regardless of weather, location, or circumstance has a substantially better chance of achieving that consistency than a practice with more specific environmental requirements. The adult who commits to walking gently for 10 to 15 minutes after meals, adapting the specific location and circumstances to whatever is available in any given moment, is more likely to sustain this practice through the inevitable variations of daily life than the adult who requires a specific outdoor route or particular weather conditions to feel that the practice counts. The integration of this practice into existing daily routines, rather than treating it as an additional item on an already full schedule of arthritis management activities, is the final practical consideration that determines whether this evidence-based recommendation translates into a sustained habit or remains simply interesting information without practical application. For most adults, the period immediately following a meal already involves some transition time, clearing dishes, moving from a dining area to another part of the home. The natural pause between finishing a meal and beginning the next activity of the day. Recognizing that this transition period can simply be redirected toward gentle walking, rather than requiring an entirely separate block of time carved out of an already busy schedule, is what makes this practice genuinely sustainable for most adults who attempt to implement it. You now understand not just what to do, but precisely why it works, when it works best, how to calibrate the intensity for your comfort, how it interacts with the dietary and other movement practices this channel has detailed, and how to implement it sustainably regardless of your circumstances. This is the complete, evidence-based foundation for one of the simplest and most immediately accessible additions to your arthritis management approach that this entire channel has provided. If this video gave you a simple, immediately actionable practice for reducing joint stiffness that you can start today, please support this channel. Hit the like button right now. Subscribe if you have not already. Share this video with someone managing arthritis who could benefit from this simple post-meal movement practice. And leave a comment below. Tell us whether you are going to try walking after your next meal, and what your current post-meal routine looks like. We read every comment. Thank you so much for watching. See you in the next one.